Hi everybody, my name is Allie Kenny and today I'm going to be talking to you about cystic fibrosis. Cystic fibrosis is a genetic disorder that is inherited through autosomal recessive inheritance. This disorder negatively impacts the protein glands in our bodies, changing things like our mucus, sweat, and digestive enzymes. While I personally feel that most people associate cystic fibrosis with lung problems, there's actually a lot more to this disorder. Cystic fibrosis impacts not only our respiratory systems, but also our reproductive and digestive systems. It also leaves patients more vulnerable to infection. There's currently no known cure for cystic fibrosis, so it is unfortunately fatal. However, with new treatments being developed, the average life expectancy is increasing. Looking at the pathophysiology of cystic fibrosis, it is caused by a defective CFTR protein, and those letters stand for cystic fibrosis transmembrane conductance regulator protein. This protein works to transport chloride ions in the body, and chloride works to thin out our secretions like sweat and mucus. So, with a defective CFTR protein, there is either too little chloride or just none at all that can work to thin out these secretions. Therefore, when our mucus gets too thick, it actually blocks important ducts in the body and reduces the flow of air in our lungs, reducing the function as well as reducing the function of our digestive system. There are actually 5 different classifications or types of cystic fibrosis mutations, the first of which is a protein processing mutation. This mutation means that the CFTR protein forms improperly. The most common example of this specific mutation is called the F508 deletion. It is when the amino acid phenylalanine is deleted at the 508 position, and this leads the CFTR protein to form in the wrong shape and just not work properly. So you can see here that the protein on the left has the proper shape and it is completely normal, and then the one on the right is that F508 deletion that is just the wrong shape, so it won't work correctly or at all. Next up is an insufficient protein mutation. This happens when there are not enough CFTR proteins to keep up with the body's demand to allow the chloride to flow through and function. Obviously, this image shows an example of the right amount of protein allowing the right amount of chloride to function, and on the right you can see that there's just not enough protein, so even the chloride that's going through is not enough for what the body needs. The next mutation is called a protein production mutation. This is also referred to as a nonsense or stop codon mutation, and this basically means that the body's genes gave the wrong instructions for making the protein and that it just stops forming in the middle of production. So you can see here in this image that the protein originally started forming normally, but somewhere along the way the body literally told it to stop, and so it did not finish forming. Next up is a gating mutation, and so the way that the CFTR protein facilitates the movement of chloride ions is through its center. It has a sort of passageway with quote unquote gates that let the chloride pass through. With this type of mutation, however, the so-called gate stays closed and no chloride can pass through at all. Our final example of cystic fibrosis mutations is called a conduction mutation. This happens when the chloride can't fully flow through the protein channel that I mentioned in the last slide. So some of it can still get through, but it's just not enough to keep up with the body's demand. As far as the causes of cystic fibrosis go, there really is only one, and it's just that it's an inherited disorder. Specifically, you get it through an autosomal mode of inheritance, which means that you get it from your parents. This type of inheritance affects all sexes equally. So cystic fibrosis doesn't prioritize affecting males versus females. Anybody can have it. Also, if you have two heterozygous parents who are both carriers for it, but they're both unaffected, they can still pass it to their children. So if said two heterozygous parents do have kids, there is a 25% chance that their child will actually be affected with cystic fibrosis, even though they are just carriers and unaffected. Cystic fibrosis has lots of different symptoms across the board, and these symptoms can appear at any age. Some of the symptoms are more mild, like salty skin, which is usually something that parents will notice when they kiss their baby. So, this is caused by the thickening of our sweat, which makes, sweat is already very salty, and cystic fibrosis just makes that salty sweat that much more concentrated. So when a parent leans down to kiss their new baby, they will notice that salty taste. It'll be more striking than otherwise. There are, of course, many more severe symptoms like difficulty breathing due to the respiratory tract being completely lined with thick mucus. Also, malnutrition is a really interesting symptom because patients with cystic fibrosis will still have a normal appetite, but because this disorder thickens mucus, in addition to harming our lungs and making it harder to breathe, this thick mucus will actually clog ducts in our pancreas, and that impacts digestion. So these clogged pancreatic ducts can even form cysts. So with the entire digestive system impacted, malnutrition is a natural consequence. As I said before, there is no current cure for cystic fibrosis, so the common treatment options are all just to help manage a patient's symptoms. If a patient has a really bad case, they may even need an organ transplant to replace their damaged lungs or pancreas, but there are also multiple forms of medication, and they can be either inhaled or taken orally. So this can include antibiotics to fight infection because cystic fibrosis patients are much more susceptible to lung infections, or something like hypertonic saline that will help thin the mucus so that patients can cough it up and get it out of their system. There are also different breathing therapies like oxygen therapy and DNase enzyme therapy just to help with a patient's breathing. A newer treatment method of cystic fibrosis has been developed recently by scientists, and it is a type of gene editing called prime editing. So with this method, the scientists are able to actually change specific letters in the genetic code and repair specific mutations. Another example of treatment is CFTR modulators, which are medications that improve the function of a mutated CFTR protein. The only issue with these is that there are different modulators for specific cystic fibrosis gene mutations, so depending on the patient, it can take trial and error to find the correct option. Overall, cystic fibrosis is a very interesting disorder that has hopefully lots of advancement to make in future treatments and maybe one day even a cure. Thank you.